Subscribe to our YouTube channel and press the bell icon to get the latest updates.
Hello and welcome to ThePrint. Today on ThePrint interview, we have with us a very special guest. This is Dr. Chandrashekhar Nair, who has this year won the Infosys Science Prize, the much coveted Science Prize in India, which has a very lucrative cash prize. But apart from that, it's the prestige that it offers that brings it, that makes it one of the most, sought out prizes in India. And Dr. Nair is, of course, he's the director and CTO of Molbio Diagnostics, which, if you do not know, is the manufacturer of the TrueNat tests, which has actually proved to be one of the backbones of the entire RT-PCR network in India that has been behind diagnosing COVID, behind tracking cases. So Thank you for joining us, Dr. Nair. It's a pleasure to have you with us.
The pleasure is all mine. Thank you for having me.
So, sir, to begin with, let us talk about your journey to Molbio. You are a scientist at heart. So, what made you, start a biotech company?
So we started in the year 2000 as Big Tech Labs, and the idea was to work on technologies in diagnostics that would allow care to become precise rather than presumptive. When you go to a doctor, typically without proper diagnostic tools, essentially we are looking at presumptive care. Our hypothesis was that if you could identify exactly what was wrong, then you could have directed therapy and you could recover much faster. And we were very enamored by this tool called PCR. As scientists, I have worked with this tool as a bench scientist, and as an engineer by training, I find this a very interesting technique because it is very sensitive. At the same time, it is very specific, and normally both of them don't go together. And we thought that if we were able to use PCR for diagnosis, we would be able to make a difference. That is how this entire journey started. But PCR typically has been a technique that was essentially limited to research labs. In fact, before 2009 H1N1 epidemic, I don't think anybody even knew about the PCR outside the research laboratories. It was not even part of medical diagnosis, very prevalent, not very prevalent in medical diagnosis. But that is the time when we got to know that PCR is important. And we were very early in our journey at that point in time, but we had a prototype that we could test and show ICMR that we were able to diagnose H1N1 at point of care.
So when you say point of care, you mean that a place which does not have the full setup of a research laboratory, but is in probably a remote location, and the entire setup is available from identifying the disease to basically getting the treatment.
Our aim was to make PCR infrastructure independent. So our aim was to open a box and run PCR under a tree if you required to. Right. So we did not expect that we would get anything from the area where we were supposed to run the PCR. That is how we have designed this, and that is what we have. We have a battery operated field usable platform. It requires minimal training, and it is a low cost platform that can be deployed very quickly.
Right.
That's what we have ended up doing.
Right. So, can you describe the initial months when the pandemic hit the world and then India? At what point did you realize that this was going to be, say, a very very big task for the country as a whole, and an opportunity for Molbio to really expand the network?
So, this has been a very long and very intense journey over the last couple of decades. It's in 2014-15 that we started engaging with the Indian Council of Medical Research to diagnose TB at point of care.
Right.
And in 2018-19 is when we got ICMR after very extensive studies in the field for them to certify that we could diagnose TB instead of using smear microscopy at a microscopy center by a microscopy technician who had no prior molecular diagnostics experience. We were able to diagnose TB and reduce the time of diagnosis from 6 months to about 3 weeks from onset of symptoms. So very sensitive detection. Now, subsequently, we did international, multinational studies with FIND and ICMR that gave us a WHO approval for TB in 2021. That was when the pandemic actually struck. And at that point in time, we had an order from the government of India to deploy 1,512 devices across the country for doing TB diagnosis at smear microscopy centers. Right. But being a company that is very actively research driven, we continuously look at newer pathogens and pathogen threats. So we were working on the COVID-19 test from the time it was first reported and databases started having COVID sequences, etc. So we were very early in our quest to have a COVID test ready on the same platform. Right. We set out to create a platform, and that's exactly what we have. So the government was able to quickly redeploy those devices to do COVID testing and increase the testing capacity dramatically. Because once that test was approved by ICMR, then we were able to do COVID testing pan-India in places that would have taken a lot of doing to have molecular diagnostics.
So roughly how many TrueNat systems do we have across the country?
We have about 4,000 of them across the country today, both in the public and private sectors.
And before the pandemic, it was...
We had about 700 devices in the private sector already. And public sector, of course, the entire movement into the public sector is driven by programmatic implementation, and we had just started implementing at that point in time.
Right. So how was your experience with the so-called red tape? It's how do I say it? It is something that a lot of companies do talk about, do complain about, that the red tapeism really slows down a lot of the work. So what was your experience?
So we have actually worked in a very collaborative fashion with multiple government agencies from the very beginning. We were funded by the New Millennium India Technology Leadership Program Initiative Program by CSIR. That was in the year 2005-2006, and then that entire platform development happened around that seed funding that we got. Subsequently, we had the Department of Biotechnology Industry Partnership Program come and support us to do validations for a few diseases. And that is when the clinical use case of this was developed. Subsequently, ICMR gave us a grant for doing H1N1 detection. And that is the time when we showed that we could do viral infections at point of care. So we've been working with all of these institutions, places like NIV, some of the best medical institutions across the country in a very collaborative fashion. So this did not happen overnight. And that journey continued. And then subsequently, even the WHO approval, both ICMR and the Foundation for Innovative New Diagnostics came together to work on this. And the premise was always that you have to have a platform at point of care to be prepared.
Right.
And therefore, I don't think that there was so much red tape per se, as far as we were concerned. It was more a journey that had started a long time ago and continued over multiple governments. But with a, I think, directed focus that this kind of a platform would have tremendous impact if and when it could become commercial. And this is just the culmination of that journey.
Right. So I think the COVID, the pandemic has it has taught all of us this, that a continuous investment in research that is done with a lot of foresight about what the country is likely to need in future and how existing networks and technologies can be adapted for emerging pathogens. That is one of the biggest lessons, right, from this pandemic.
Absolutely. I think we have to be completely self-sufficient in terms of our own needs. India as a country is fairly unique, but very similar to maybe about 30, 70, 80 low and middle income countries across the world. There are parts of India that can afford any kind of diagnostic test, and centralized tests there can make a lot of difference. But there are parts of India where access is so difficult. So when we have a device in a place like the Laul Spiti Valley or in Kargil, these
Mhm.
are places where you can't think of doing diagnostic tests with a molecular diagnostic platform easily. So I think we require to invest continuously in technologies and in health preparedness such that we can ensure that pandemics don't completely disrupt our lives as we go ahead.
Right, right. So also, like, do you feel that there is some sort of a discrepancy even within India, where when a pathogen is found in, say, a state like Kerala, we have a definitive sense of what pathogen it is within, say, a day or two. But when something like that happens in UP, we have mystery virus running in the headlines for a long time, because those areas are not as well equipped. So how do you say navigate these inequities?
I think the COVID pandemic has given us the opportunity to really navigate these situations, and almost every state in the country today is prepared. Our healthcare system is much more prepared than what we were before the pandemic, and that has been driven by need. But it is something that has added significantly to our healthcare infrastructure, and I think we will definitely benefit from this in the long run as a country. We should possibly not have those mystery pandemics running in any state. Uh,
Right.
we will possibly, because everything from molecular diagnostics to sequencing
Mhm.
has been installed, validated, and run across every single state in the country today.
Right. Right.
So that I think has the upside from this entire COVID pandemic, that we are prepared more. Even care has improved dramatically. Facilities of all primary care centers have improved dramatically, and unfortunately, it took us a pandemic to kind of get there. But I think we are prepared much better today than what we were earlier.
So also, sir, you hold a number of patents, and I wanted to ask, in the context of this pandemic, what do you think about the whole debate around having or not having patents at the time when everyone needs access to information, to research, to science, and what is your opinion about open science in general?
So personally, I have been a proponent of open science, primarily because I believe that if you're looking with a public health focus, it is very important that we provide technologies that are required to address public health requirements. And I know that from a private sector perspective, it is also very important to protect yourself with a patent, so that first of all, nobody else feels that you're infringing theirs. Unless you go out there and kind of put it out there that this is your intellectual property, how are you sure that you're not violating somebody else's, or somebody else does not have a claim over that? So
Right.
from that perspective, that process is very important. But when it comes to a pandemic, I think there are many more challenges when it comes to public health. The entire business of scaling up and ensuring that tests are supported across a very wide distributed network like what India is itself a massive challenge. And I don't think that we should limit too much by way of patents in terms of access.
Right.
Patents are great, but there has to be access, and that is what we should focus on, at least from where I'm coming from.
Right. So right now, are we still scaling up on tests on diagnostic centers, and or has that sort of like plateaued right now since cases went down?
No, I think what has happened is that we've really increased the diagnostic network's reach. whether it is closer to point of care like what we are, or whether it is with the larger centers, setting up more satellite centers, etc. And awareness has built up tremendously. So today, a clinician will not hesitate to prescribe a PCR test for something like chikungunya,
Right.
which was not the case earlier. So I
Right.
think that will result in better outcomes for patients and better outcomes for the country's public health itself. Because the earlier you diagnose, the faster you treat, you ensure that the disease is not transmitted, if it is a vector-borne disease or if it is an airborne disease, etc. And you control spread of disease. I think this will be very good for us.
Right. So, and is the TrueNat manufacturing process based completely in India, or is it something that still needs to be worked on?
No, we have massive manufacturing facilities both in Goa primarily and in Visakhapatnam at the Andhra Pradesh Medtech zone, and we have a capacity to do up to 400,000 tests per day today. So that is something that we have scaled up and focused on scaling up, because the pandemic has taught us that when there is a need, you have to address that need very quickly. And at that time, you can't think of scale up. So it is from
Right.
that perspective that we have gone ahead and invested in these facilities.
Right. Also, we also saw what depending on supply chains from abroad does to a country like India. We did have a situation where certain drugs or certain pharmaceutical ingredients or something like glass vials for syringes. These were things that were imported. So, is there something in TrueNat also that that is dependent on supply chain from abroad?
So semiconductor components are anyhow all imported. The design is ours. The manufacturing happens in India, but you still have to import components. And now I think India is investing heavily, or looking at investing heavily in semiconductor manufacturing. We kind of missed that bus a little while
Right.
ago, but there are massive shortages in chips, and supply chain for those are disrupted very badly, and I think it will take some time for it to stabilize. Those are things that we will require to continue to invest as a country, but many other areas like swabs, for example, which is also imported, are now being made in India in very large numbers.
Right.
So some of those basic facilities have already been established in the country. We're not very heavily dependent, so we have a distributed supply chain that we have tried to mitigate supply chain risk with, and I think we're fairly comfortable there.
Right. All right, sir. So, what is the next frontier for TrueNat? So, for those of our viewers who are not aware, TrueNat is actually a very versatile platform which does, diagnose a lot of viral diseases. So what do you think is the next step? Are you looking at some particular disease, or increasing the network, or continuing research on emerging pathogens?
So today we have about 30 diagnostic tests that can be performed on TrueNat. At any point in time, the R&D team is working on another 30 tests. So we will continue to add to this very extensive menu on a constant basis. We are also proactive in looking at what needs to be done. For example, we already went ahead and tried to design a test for Omicron. Now, if the system needs it, if the healthcare system needs a very specific test to identify Omicron, almost all RT-PCR tests today will detect Omicron. That's not a problem. But if you want to identify the strain specifically without sequencing, we're ready for that test. When Nipah came out, we were ready for the Nipah test very quickly in collaboration with NIV. We are working on diseases like the Casimir forest disease that people have possibly not even heard of, but that could be a potential pandemic threat again with ICMR. So we continue to keep our eyes and ears open in terms of what we need to do. We're also working on many other advancements to the technology that would help improve both the penetration and the reach of this technology.
Right. So circling back to Omicron, since that's one of the headlines right now. So I will probably link that report in the description. I have done a explainer, sort of trying to explain how the S gene dropout does help identify this particular virus, particular variant. So are you saying that that your test can sort of be tweaked or cater to it, or does it already identify the Omicron variant?
Our test identifies COVID across the variants because we currently work on conserved regions of the virus that we pick up anyhow. Whatever.
By conserved regions, you mean those that are not mutating?
Non-mutating genes. Okay. Now we also have a test for the Omicron dropout, as it is called, to ensure that not only do you say that it is COVID, but you can also say that it is the Omicron variant. So that test is also ready. And as and when there is a need, we will approach ICMR and see whether that is a specific need. Because as of now, see, I think from a public health perspective, we also have to see what exactly is the impact on public health, whether it is Omicron or not. And based on those systemic needs, we are ready to kind of intervene and do our bit.
Right. Of course, right now we still do not know how disruptive this new variant can be. It may turn out to be, hopefully it'll just turn out to be a hype and nothing more, but we still have a data coming in for that. We're not really sure. So is there anything else that you want to add? What was your biggest takeaway from, of course you talked about being ready for the future, investing constantly, but any other thing that this pandemic has taught you?
I think from a entrepreneurial perspective, this pandemic has also shown that solutions for our own problems need to be designed by us, and we need to be ready. And considering that we were able to address the needs that were shown during this pandemic, hopefully this will be a fillip for many other entrepreneurial journeys that are there. A lot of innovation investments have happened in this country, and we have a very vibrant startup system now, ecosystem in this country today. And hopefully they will also see actual go-to-market stories and build on their own journey with a little greater intensity of purpose. I'm sure that all startups work very aggressively, but this is also something that they can take heart from, isn't it?
Right. Thank you, sir. Thank you so much for speaking with us. This was a really interesting conversation, and I understand that this whole journey was based on a very disturbing, very disruptive, and a very tragic time for a lot of Indians. But it did bring out the best of a lot of aspects of our country and its entrepreneurs. So thank you once again. Thank you for your work, and congratulations again for winning the Infosys Science Prize. And we hope your journey continues and it strengthens our nation's public health care system.
Thank you so much. It's been a massive team effort, and I can't tell you so proud I am of our team that has forgotten about everything, including the pandemic, put everything at risk and work towards ensuring that we meet the needs of the country at this point in time. And hats off to them.
Thank you, sir. For our viewers, thank you once again for joining in, for listening to this interview. I will link down below an explainer of what TrueNat is and how it's different from different tests, a piece that I had done long back in the pandemic, and also the piece about how the Omicron virus is different and why it's easier to sort of detect with RT-PCR tests. Thank you, Dr. Nair, once again, and do keep following us. Do hit the subscribe button on our channel. And once again, I'm Mohana Basu, special correspondent at ThePrint. Thank you.